on the hospital-acquired infections. So basically, there are a few infections here that I want to touch on, but some are from gastrointestinal. That means from your diarrhea, you can get this fecal-oral transmission, contamination of your hands, and mainly the source is the fecal, and this is all the viruses that you can get. And from the respiratory tract, when you cough, speak, and sing, and you can have this droplet precaution, and you can contaminate your hands, and these are all the viruses that we have, including COVID, where we think it's a coronavirus that has also droplet involvement. Okay. And the other one is in your skin lesions. This skin lesion also can transmit to airborne, and it can present some of the lesions in your urine and skin where it's contaminated, and the virus is passed through your fecal and urine. These are the common virus which I'll touch later, and some are just blood transmission, which is HIV, hepatitis B and C. So CDC has mentioned, I will touch more on airborne hospital-acquired infection. So CDC has mentioned some of the spores that's available in our hospitals. So thankfully, we don't see much of anthrax and bacillus. But aspergillosis, it's a big problem for us, especially when renovation is occurs. And community-acquired people who don't vaccinate, or we do still cases of chickenpox and herpes zoster in the virus, and we still see cases of measles in the hospitals. And now the big problem is the COVID. I'll share you some data on tuberculosis in the hospital, as mentioned from the previous speaker. So these are what the recommendation in terms of precaution. At the ending, I will briefly touch what is all this means, standard precaution. But usually for blood-borne viruses, standard precaution is usually needed. Anything that is can drop at least 3 to 6 feet, droplet precaution is needed. Okay, so you can see a lot of the precaution that is mentioned here. So Haemophilus influenza is another droplet precaution you can see here, and basically a lot of standard precaution, thankfully. So most of this droplet precaution, we don't usually have a negative pressure room or even a standardized room, because most of our hospitals are open ward. So that's why in terms of if patient can wear mask in the hospital, that will be great, but it's very difficult when the patients usually don't wear mask because they are not so well. Okay, so it's very important actually for us to actually wear masks in the hospital, even before the COVID, in terms of droplet precaution, especially dealing with a lack of ICU, a lack of negative pressure rooms in our hospitals. Okay, just to show you the variety of microorganism and the precaution that we need to do in terms of reduce transmission from patient to patient and patients to healthcare worker and even healthcare worker to patients. Okay. I think this some of the data showing microorganism in the dough in terms of bacterial, viral, pollen, spores, and algae, which I won't touch because the previous speaker had mentioned. And this is how we transmit even from breathing. Some people don't believe that breathing can transmit aerosols and droplets, but they do, although less in terms of velocity. And in terms of for hospital infection, we always say how many patients can a patient who's positive transmit the virus to, and this is the R naught. And the king is always measles. So one patient with measles can infect 12 to 18 people with measles. Okay, and this is airborne. Diphtheria through the saliva can infect 6 to 7. Smallpox airborne can infect 5 to 7. Okay, now the Delta virus COVID, also now we are talking around one patient's positive Delta virus can infect 5 to 7 patients. So same things with measles and mumps, and 5 to 7 patients. This is mainly pertussis, SARS, 2 to 5 patients. Influenza, 1 patient can affect 2 to 3 people. So this is the transmission. So I'll show you some of the bacteria. This is our Malaysian data for MRSA. This is one of the hospital-acquired infection. 80% of MRSA is developed from the hospital and 20% from the community. So for the past 10 over years, you can see the positive rate is around at 20%. Past few 1-2 years has come down to 15%. So MRSA is a big thing, and mainly it's coming from a medical ward and surgical ward and orthopedic ward. And mainly it's coming from the blood, tissue, swab, pus, trachea. Trachea means through the lungs, sputum, respiratory, and the wound. So you know where your MRSA is coming. Acinetobacter baumannii is another gram-negative bacteria, also very problematic in the hospital infection because we don't have antibiotic to treat this multi-drug resistant. We actually don't have a lot of organisms. We don't have antibiotics to treat in our hospital because they are multi-drug resistant. So this one also is sprayed through the trachea, through the lung, blood, sputum, and urine. Okay, where is it coming from? Mainly our sickest patient, medical ward and ICU patient and surgical ward. So the sickest patient has this Acinetobacter, which is a big problem because we can't treat. Okay, so even Acinetobacter can contaminate the surface area, although it's not so common. But if you don't have good ventilation, good air exchanges, a patient with Acinetobacter can transmit to another patient. Same thing, this paper showing that when you're colonized in your rectum, in your area, you can actually transmit the virus to other people through the colonization from Acinetobacter through your anal canal. Okay. And these are some studies that looked at in Iran that looks at 4 hospital wards and look whether bacteria can be airborne. Okay, so they sample all this and they found beta-lactam resistant bacteria, means antibiotic that is quite resistant in air samples, 3 to 34%. See what is the commonest? Our most worried organism, Acinetobacter, is in the air sample, contaminating in operating room, ICU, and medical ward. So we don't have antibiotics for this. This is a paper from France looking at multi-drug resistant organism in air samples in nursing care patients. They found that from 45 patients with proven colonization, 22% is already in the air samples. So these are all multi-drug resistant in the air samples. This paper from UK looking at Clostridium difficile. Clostridium difficile is patient will present to you with diarrhea. This diarrhea data, as they pass stool in the room, you actually have to put in isolation room. If you don't have isolation room, as the patient pass diarrhea, this actually can also be contaminating the air and the surface. So in this paper from UK, at least up to 60% of patients had both air and surface environment that was so positive with the same strain of the other patients. So this is how the strain, because it's a spore and you start to transmit and you get severe diarrhea. Okay, so even simple things like changing bed mattresses. See these patients, this is the mean bacterial count in the hospital air, and after vigorous bed making, changing of the bed, you can see the bacterial count increase very high. The microbial carrying particles, just simple things like that. Okay, and so TB, I just want to show you TB in Malaysia. We still have 24,000 cases in 2020. Selangor always champion, 5,000. With KL, 2,000. 6 people die every day with TB. Okay, treatment is very long, 6 months. Okay, 87% involving Malaysia. Okay, so we are moderate country, 92 per 100,000 Malaysia. So TB, we still cannot get rid of it. Just looking at Selangor data 2009, you can see in healthcare worker, nearly 48 healthcare worker picked up TB. So healthcare worker are picking up TB mostly in the hospital. Okay, and TB don't only destroy the lung. It can go to your heart, can go to your liver, kidney. So all this we manage. Heart TB that goes to the heart, TB that goes to the kidney, TB goes to the brain, to the joint. Okay, you can involve all from your head to your toe. That is TB, and it's very hard to treat. 6 months of treatment. Okay, patient need to be compliant. Okay, so it can attack people. Many people think TB is just in the lung. TB can go anywhere in your body. Okay, so these are pictures of fungal infection. You can see how damaged the lung is. Okay, and as the previous speaker mentioned, renovation. We see all this funny name of these fungals, which are actually very hard to treat as well. and fungus has been growing in the unfiltered air, ventilation system, duct system, carpet, food, plant. That's why we try not to keep food and plants, especially plants at home, because they can actually plants in the ward, because they can actually pick up fungus, and the patients can actually inhale this fungus. There are new, more dangerous fungus also appearing, which is very hard to treat and is spreading everywhere. Candida auris. Okay. How about virus? So many people think this is chickenpox. Okay, chickenpox. Many people think chickenpox is nothing, childhood disease, and some people don't get vaccinated. But when you get chickenpox as an adult, not only that, you can spread. Okay, it's a very high rate. You can present about 9 out of times to a lot of people through aeration, and you're contagious. That means before you develop rash, you already spread to virus 1-2 days before, just like COVID. Before you develop symptoms, you can present the virus. Okay, and as usual, as any other bacteria, this can actually affect a lot of things. It can get high up, 15 to 20%. Okay, bacterial infection, ear infection, bacterial infection, bone infection, lung infection, heart infection. So it's not a simple thing, chickenpox, because we manage the complication of chickenpox. Okay, although many people think chickenpox is harmless. So you can see a very bad chickenpox lung. Very hard to be. You can affect your brain. You can get a brain infection. You can get brain damage. A lot of people die when they get chickenpox go into the lung, especially as an adult. Okay, and you can actually transmit to a lot of patients while in the ward as well. Okay, and same thing with measles. It's very contagious 4 days before the rash. So you don't even know you had measles. Only when you rash, then you think you got viral infection. But 4 days before the rash, you are already contagious, and you can really transmit to 9 to 10 people. Okay, the virus can remain airborne up to a few hours in the air. So if you walk along, you may pick up the virus. Okay, same thing like any other virus. Okay, measles is very dangerous also. It can cause brain damage, can cause blindness. Okay, severe diarrhea. Okay, and severe bacterial infection. Okay, hearing loss, lung infection, brain infection can cause death. Okay, and this is also very dangerous. So just to tell you things like chickenpox, measles, although people think it's nothing, actually it's also very dangerous, because we manage all these patients in the ward. Some people think measles has disappeared in Malaysia. Not true. It's up and down, and later. So we have about 1,000 to 2,000 cases a year in the hospital. Okay, influenza, now people forget because COVID has come, but it's still in the background. We will have pandemic from time to time, and again, some people think the normal influenza is nothing, but it's not true. Influenza can cause brain infection. It can cause you to difficult to walk, spinal involvement, lung, heart infection, can cause severe secondary infection. People die of influenza after secondary bacterial infection. Can cause a lot of pregnancy complication and also muscle damage. Okay, so all these virus, although people think it's harmless, is not true. MERS, we still have MERS from time to time, but lately, because of the less travel one, we don't see much of MERS. But once traveling start to occur, then you probably see occasionally MERS in the hospital. And again, mumps, it's still there. Again, people think mumps is nothing. You just get some swollen salivary gland, fever one. But again, any virus can cause brain infection, deafness, okay, and even can swollen testes. All right, so these are all the complications of mumps. Okay. So I'll finish off to tell you some of these transmission-based precaution that we are doing in the hospital. Okay, so standard precaution usually involve in blood. Okay, if the patient has some blood secretion and everything, the mucous membrane and non-intact skin, that we will do standard precaution. So basically, hand hygiene, wear glove, wear mask, if the splashes is occurring, apron, environmental control in terms of spillage, linen change, and cough and hygiene precaution. This is the 5 moments of hand hygiene that we before touching the patient, and after touching after doing any procedures, after patient contact, okay, after bodily fluid exposure, and after contact with patient surroundings. So we are very happy if you can even healthcare worker wash the hand before touching the patient, and after touching the patient before he leaves, in fact, to wash their hand is already fantastic already, before touching the patient and after leaving, or else, there are a lot of things on his hands. Okay, and the three the three precautions that I'm going to finish off here is first I want to talk about airborne precaution. The nuclei is less than 5 micrometer, and this is the one that we are worried. So we like to put in negative pressure room. A lot of hospitals don't have negative pressure rooms, including ours. And finding single pressure room is also very difficult. And so sometimes we end up doing cohort. So it's very important if the patient can wear a mask. This is not usually doable. So very important nowadays to wear face shield, eye protection, glove and gown, and like what the previous speaker mentioned about patient transport. It's very important. Getting a proper transport is also very difficult. So droplet precaution is for the particles that is above 5 micrometer liter, and this is very risky when the patient talks, coughs, and sneeze. So in terms of this one, we prefer to actually have the patient in single room, but most of our single rooms are now occupied with COVID and also airborne precaution. So end up single room, we usually cohort them in one corner. Okay, because most of our ward is actually a general open ward. Okay, so the same recommendation is mentioned. Respiratory precaution: wear mask when working within 3 feet of the patient. Okay, glove and hand is always standard. Wear a gown. Okay, because sometimes patient cough and end up in your shirt. Okay, and you touch your shirt and you touch the patient. You never wash your hand. You touch surfaces, and they can last a few hours in the surfaces. And then we touch our eyes about 10 to 15 times an hour. So it goes to the mucous membrane. We touch our nose, we touch our mouth, and then it's how it's sprayed. Okay. And, finally, contact precaution is usually for blood spillage. If you can get single room, it's okay. Like I said, mostly doesn't happen. Then usually they end up in the general ward, and usually the standard precaution in terms of glove, face protection, respiratory protection, only when you have spillages. Okay. So these are the three precautions that we do when we are dealing with virus. Our main issues is we don't have many negative pressure rooms. We don't have many single rooms. Most of these patients are actually in the open ward. Priority is actually to airborne precaution. So TB, measles, as you have seen, measles already spread. TB, measles, but unfortunately now a lot of COVID. All right, that is occupied. So mask is very important, despite what you hear. Okay, many people think mask is there's some complot about mask not wearing, but I think this.